Bula Vinaka Fiji, and a warm welcome to Speak Your Mind on Gold FM, only the classic hits. I'm Louise Kaunisela. November is National Diabetes Month, a time to bring attention to the disease and its impact on people in the country. The theme this year is family and diabetes. And my guest in the studio today, we have from the Diabetes Hub Center in Suva, the medical officer, Dr. Rajeshwar Sharma, and we also have the Foot Care Project Officer, Mr. William Mengio. A warm welcome to Speak Your Mind. And just could you please tell us a little about the history of Diabetes Fiji Incorporated?
Thank you. Diabetes Fiji Incorporated is a charitable organization. It was established in 2012. Its mission is to have diabetes in better hands. So in terms of service, improving of service, work with the ministry in terms of improving of services, creating more awareness and also advocacy. And some of the objectives we have is to create awareness so that we can prevent people from getting diabetes. Also, those that are living with diabetes, to empower them to take ownership of their own health.
Mm-hmm.
And also, the thirdly is to lobby with the policy makers to create an environment that are conducive to those living with diabetes. And so we are based at 325 Waimanu Road, just opposite CWM Hospital.
Yes, okay. So what is Diabetes Fiji's mission and objective?
Yes, so as I've mentioned, our mission is to have diabetes in better hands. So whether it's improving the services or creating awareness or to working with advocacy with stakeholders to lobby to government to create policies that are conducive for people living with diabetes.
Yes, and we have a lot of people living with diabetes in Fiji, don't we?
Yes. So we last NCD STEP survey that was done, we have a 16% of the adult population that have diabetes. Dr.
16%, 1/6?
Yes, one.
Okay, so that's a lot.
Yes,
that's a lot.
Yeah, and okay, well, anyway, Diabetes Fiji is currently running the Foot Care Project with the Ministry of Health that began in 2014. Is this project still running, and why is it important?
Yes, Louis, so this program is still running. As you know, diabetes amputation is the leading cause of disability in Fiji, and we have amputation taking place every 12 hours. So that's the reason why we have the high number of disability due to diabetes, and that's the reason why we have this Foot Care Project, so that we have more awareness, done, and also our nurses are in better hands to treat our foot problem that could save amputations.
I see. So what do you do when you try to save an amputation?
Yes, so we've trained our nurses in terms of management of foot problems, and so what happens is they're able to detect the problem early, and they're able to treat the problem early before they get. Dr. Rajesh, do you want to?
Okay, yes, I think Doctor would be good in answering that
the
question.
Management of amputation. By the way, amputation means chopping of the legs. It's an unfortunate event when the legs are very badly infected. Now, for this program, we have multiple programs. First is staff training. We've trained medical officers, staff nurses, and we've also trained workers. This is nationwide. So it's also in Lambasa, it's in the west, it's also in Suva. And we have also formed peer groups, which we'll talk about later, where diabetics themselves will influence each other. In addition to training staff, we have established health center levels, foot care clinics, which Willie will elaborate.
Oh, okay.
So we have trained roughly about 289 nurses, and we've trained also 261 doctors. These are the trainings to do better management of diabetes. We have also established food clinics, and so some of the health facilities, if you enter, they have food clinics. We have 15 dedicated food clinics. So that means these are the dedicated ones that fully operate as a food clinic. And we have it in Osori, Nakasi, Valilevu. We have it in Namaka, Ba, Nendi, Lambasa. So it's all around.
That's really good.
Levuka, yeah. But in all health facilities, you can always ask for a nurse in terms of if you want to see or if you have food problems and then you want to see a nurse. You have food care nurses. They are based in all health facilities in Fiji. Of course,
So obviously, it's really important for diabetic patients to look after their feet. Well, that's why you've put in so much emphasis on, looking and having all this awareness on how you should look after your feet. And you mentioned also that, it has to be really, just started instead of waiting for it to go really bad and then go and see the doctor. Is that right, Viliame?
yes, yes. So as I mentioned, it's early detections. That's one of the key things we want, and we want patients to present very early if they have food problems like small blisters and cut. So that could avoid unexpected amputation that we have.
Exactly, yes. So, what are some of the milestone achievements in terms of training and improving of healthcare services?
So yes, so as I mentioned, we have established food clinics around it. So one of the biggest milestone was No Sorry Food Clinic, and everyone knows No Sorry Health Center. It's always crowded, and it's always people are always complaining. These are long waiting hours. So we had established this container food clinic in No Sorry. Some of our patients, our diabetic patients, they come at about 7 o'clock, 6 o'clock, and they'll wait till 10 o'clock to be treated because the health facility have to see the school children first. So my
Okay.
patients have to wait till 10, 11 until they have the dressing room gets clear, and then they get to be seen. Because one patient, they get when they have to go for dressing, it will take roughly 20 minutes. So in terms of waiting, by the time 10 o'clock, 11 o'clock, they're already in stress level and the sugar is high. So
Yeah, that's what you
yes.
don't want a diabetic to have is, high stress levels.
Yes. So we have established this food care container clinic, and
Okay.
through this food care clinic, our nurses are able to see their patients on early, and also they are able to have services where all our diabetic go through. So they don't have to wait anymore. Secondly, they're able to get seen in a better care, better health facility. Yes.
Okay, that's fantastic, Viliame. On Speak Your Mind, this is Gold FM, only the classic hits. We'll be back for more, so do stay with us if you can. Welcome back to Speak Your Mind on Gold FM, only the classic hits. I'm Louise, and I do hope you find this program, educational, especially if you're living with diabetes, which I must say is a nasty disease. So, Viliame, you also have community programs such as the Diabetes Community Peer Support Group. Can you share of its success stories?
Okay, so we have this diabetes community peer support group we have established around the countries, and roughly about 2 to 3 in each subdivisions. And these are communities that we have high number of people living with diabetes, or also we have people living with complications. And I say complications means they probably must have gone through an amputation, or yes. So we have some success stories from this peer group. The aim of this peer group is for people to share their success, share in their stories. They can meet, and also they do the testing, which helps them to know their health status, and also empower them to take ownership of their own health. So we do programs like gardening, cooking, healthy cooking practices, exercise. So some of our peer group have started their own programs like yoga, and some of our peer group have started their own program like backyard gardening. We had a community in Rewa. There was an 82-year-old bilateral amputee, meaning both leg been amputated. She was confined to wheelchair, and through this program, we've been doing backyard gardening. She was encouraged to do backyard gardening at that age and at that health status she has. And today she has done gardening, eggplant gardening, Dalo farming, and she does better than some of our young people out in the village.
Oh, I can
Yes,
imagine. Man,
yes.
that's just
So,
amazing.
so this program has encouraged even people with, we have people coming out of amputations, confined to wheelchair with just one leg amputated or just a toe,
And this is an
and this is an
82-year-old
82, yes,
woman
yes,
planting
yeah,
better
planting.
than probably young people who can't
Yes,
even plant
yes, yeah.
a
So
vegetable
we
plant.
also have a village in Yandua. This Yandua village. So what happened is through this program they have did a backyard gardening, and the aim of the backyard gardening was to improve the eating habits in the village, and especially the school children. So we were targeting those living with diabetes, but now they are empowering their family, and they're doing community program too. Today they have set out their village as a smoke-free home, smoke-free. So that means people don't smoke inside their home. And through this peer group, they've become a vocal too. So they've been advocating too in their own community setting. And another one was our Angaloa peer group. So we have and we had a lady there. She was almost in late stage of kidney failure. And through this program, she has changed her diet, and not only changed her diet, she has changed the whole family, the diet of the whole family. So the support from the family too came through this peer group program. Dr. Rogers?
Yes, and the other success is medical success. We also test their blood for control of diabetes, and we have seen in general the control is far better when they are in the peer group.
Okay, yeah, because you're with people, and you
They
have more
encourage-
fun, and they encourage one another, I suppose. Eh?
Yes.
Okay, so that's what you discovered, and it's working really well.
And this is a national-wide program again,
Mm.
and it's all over Fiji. We have several peer groups.
Yes. So we have established about 32 peer groups. So what they also do, they go through the clinics where they have this clinic, and they do demonstration also. So they teach other diabetic. What we've seen is that when diabetic see another diabetic sharing their story or teaching them, it encourages them more than someone from who is not in that state of living with diabetes. So
Yes.
this peer group, they go, they share their success story, and they teach them how to look after their feet, how to prepare healthy meals, what are the simple exercise they can do at home, especially at that, some of them were at that age, old age, yeah, and thinking that they will not able to do any more exercise. So they teach them how some simple exercise that they can do at home.
So it really, diabetes is not a death sentence, right?
Yes.
I mean-
Oh no, it is not. We
Okay.
can control it, and we have proven and shown that it's controllable, and people are living longer and longer if they are able to control their diabetes.
Yeah, and so it's all up to the person, how much that person wants to live a quality life.
Yes, they can live a healthy, normal life as long as possible, provided they are able to control their diabetes.
Right, so like things that you were saying, management, what you eat, exercise, all these things go hand in hand. Okay, so if business houses and communities want to have screening in their area or workplace, how can they go about this?
We have another program too that we do. It's with the corporates. We do screening with corporates. It's not only about testing sugar. It's not only about blood pressure. It's also getting to see dietitians, getting to see a counselor on stress level. Stress is also affected to NCDs, to diabetes. So this community program, that the corporate screening we have is a more holistic one, where you are also seeing a specialist, seeing a dietitian, seeing a physiotherapist for exercise program, and also we do community screening, where we reach out to the community to do screening. And our main aim is to detect early, so that they can know the health status and prevent them from getting diabetes. And also for those that they've been tested and are known as high risk, that they get referred early also, so that they can get early management.
Okay. All right, on Speak Your Mind, this is Gold FM, only the classic hits, and we'll be back in a moment for more, so do stay with us if you can. Your Mind on Gold FM, only the classic hits. Thank you a lot for your good company. And our guests are from Diabetes Fiji Incorporated. We have from the Diabetes Hub Center, rather in Suva, the medical officer Dr. Rajeshwar Sharma, and also Food Care Project Officer Mr. Viliame Ngio. Now, Viliame, can you tell us about Young Diabetes Fiji?
Thank you, Luis. The Young Diabetes of Fiji was established in 2015. This through after a camp where our juvenile attended a camp at the Christian campsite. So they established this. It's more also like a peer group. The aim of this Young Diabetes of Fiji was to look out into issues that are related to young people. So it mostly focuses on the young ones, our young people that are living with diabetes. Issues like the consumable. For adult, mostly they are they are mostly on tablets. But our young ones are mostly on insulin, and it's necessary that they have their own machines, and they also inject themselves, and that they have a good supply of syringes. So these young ones, through this Young Diabetes of Fiji, was able to raise funds to purchase machine for individual people, especially the underprivileged children that are living with diabetes.
Okay.
And also they were able to secure some assistance from our donors to get syringes. So it helps them to. Firstly, helps them to better manage the sugar, better manage their blood glucose, and secondly, equip them with necessary consumables so that they don't miss out clinic, they don't miss out the injections, and secondly, this Young Diabetes of Fiji is also creating awareness to other children. So they do school outreach, community outreach, just to create awareness on diabetes that are existing amongst our young ones.
Oh, okay, I find that really sad for someone young to be living with diabetes. So, doctor, is it something to do with diabetes being passed down in the family, or what is it that young people actually get diabetes?
So younger people usually have type 1 diabetes, and that is an autoimmune disease. Auto means self, where the body itself starts destroying the pancreas. Pancreas produces insulin, which is important in diabetes. Lack of insulin causes diabetes. Now, these young people, when their pancreas is destroyed, then they develop diabetes, and therefore we have to give insulin. Unfortunately, there are no insulin tablets, therefore they have to be given by injections.
Yes, I had a friend once who kept injecting herself, but this is when I was overseas. And it's really sad, but she had to do it every day.
Yes, it can be very challenging giving insulin every day, more than twice a day. And these are younger children, teenagers. They are battling through their younger childhood issues and teenage issues, and they're battling diabetes. So Diabetes Fiji, in addition to consumables, also are giving monitoring devices where they can test their glucose every day and they can adjust their doses if necessary.
Okay. Do we have many young people living with diabetes in Fiji?
It's not much compared to type 2.
Oh, okay.
But our program, the Young Diabetes, is to to empower them to take ownership of their health. So we have type 1s, or the young ones, successful in their life, in their career, and we want to encourage the other ones to go in the same path. And that's the importance that we have our family support.
Yes.
Our friends, because most of them live in attending school. So, if they have friends, be supportive to them. I mean, Lois, you will know Kathy Freeman, who is a gold medalist.
Oh, yes,
and
I definitely
she's
know
a type 1 diabetes. And
if she can reach, I never knew that.
If she can reach that level, then our young ones too can go that far too.
Olympian.
Yeah, so we need a family support. We need friend support, peer support for those that are living with type 1 diabetes, because they are just a normal people.
There you go.
Yeah, they're just a normal people, only they need insulin injection on a daily basis. Yeah.
See, there you go. So, doctor, just how does diabetes cause complications?
Okay, diabetes, the disease itself is story of glucose. Now, what is glucose? A lot of people say sugar. It's not actually sugar, it's glucose. Now, glucose comes from the food we eat, the starchy food and sugary foods. and our bodies also make glucose. Now, glucose is our fuel, just like the fuel of the car. The car
Oh.
has its own fuel.
Mm-hmm.
Our fuel is glucose. Like I mentioned, it's come from the starchy food, the carbohydrates, and our bodies produce. So if you're not eating any food at all, our body will produce it. Now, when you have eaten starchy food, it's digested to glucose. It's taken up by the blood vessel, and from the blood vessel, it has to enter the cell, the body proper. So muscle cells, heart cells, and so on. Our body is like a house. A house has rooms, and the corridor is the blood vessel, and the room is the body tissue itself. So to enter from the corridor into the blood vessel, you have to go through a door. Similarly, glucose, the fuel, has to go through the door, and to enter into a door, you need a key. Insulin is a key which opens the door to allow the glucose to enter the cell. Now, if you have lack of insulin, or when the door is shut, the glucose will be stuck in the blood vessel. Now, if it's stuck in the blood vessel, like anything sweet, the blood vessel will start rotting. So, imagine if your blood vessel starts rotting in your eyes, you develop blindness. If your blood vessel starts rotting in your heart, you develop heart attack. If it starts rotting in your kidneys, you develop kidney disease. If the blood vessel starts rotting in your legs, you develop an infection which will not heal. So, at the center of it is the rotting of the blood vessels. Both the big blood vessels and the small blood vessels can rot, provided the diabetes is not controlled.
Okay, that's what's the main thing. If it's not controlled, all these complications will happen.
Yes.
So now we'll have to talk about how you avoid the complications.
Okay. Avoidance of complications, first and foremost, you have to diagnose diabetes. Now, in general, most people may not have symptoms. You and I can have diabetes where our glucose is stuck in the blood vessel and we don't know it. Some people have complications. Some people have symptoms. You may lose weight, or you pass a lot of urine. So if you wake up and pass a lot of urine at night, that's one of the symptoms of diabetes.
Okay.
You may feel thirsty a lot, or you may feel hungry a lot. You have cuts and wounds which don't heal. The easiest diagnosis of diabetes is just go to any health center, any doctor, any pharmacy, and have a simple 1-minute blood test, and they'll test your blood glucose, and if it's high, they'll tell you, oh, you've got diabetes. And the next step is to see a doctor.
Okay.
You have to see a doctor to control your diabetes. Unfortunately, most patients, not most patients, most people who have diabetes, they tend to have herbal medicine. I'm not against it, but in addition to whatever you do, you have to see a doctor.
Okay.
A doctor at any health center, any health faculty, either a government doctor or a private doctor, you have to see that person, and your doctor will make a plan for you. Diabetes is a complex disease. You'll need to see a lot of people. You need to have dietitian, stress counseling, food care nurse. You'll need to see a physiotherapist, and of course a doctor. So we have a team of doctors and other staff managing diabetes. So whenever you have seen your doctor will further assess you. They'll assess your heart, your eyes, your legs, your kidneys. It's a total body combination assessment.
Yeah.
So they'll do blood tests, they'll do x-rays, ECGs, and determine where you are, how severe your diabetes is. You have a 3-month test called HbA1c, and that will show us how severe your diabetes is. And depending on your severity of diabetes, we'll plan out your management.
Okay.
Okay. The management is twofold. One is non-pharmacological, that means no medicine.
Okay.
We have diet, exercise, and stress management, and so on. We simply call SNAPs. And the other fold is medication, the pharmacological.
Yes, so what I gather is, well, because of what you've said, there are a different type of diabetes. There's type 1 and there's type 2. So probably the type 2 one is the one where they don't need the injections. Is that right?
Yes. Type 1 means your pancreas, the cells which produce insulin, has been destroyed and you don't produce insulin at all.
Yes.
Therefore, you have to give insulin by injections. Type 2 has various stages. Early on, you have less insulin production, and over a period of time, the insulin gets less and less. You may eventually end up not producing insulin. So even type 2s may end up getting insulin too.
If they don't look after themselves.
No, it's the disease process.
Oh, I see.
Yeah,
I
it's a
thought-
progressive disease.
Oh,
Type 2
okay.
is divided into 3 subtypes.
All right. Carry on. That's fine.
The 3 subtypes are one small group which is very serious. Another subgroup is very mild. You can have diabetes for long time without showing any symptoms, any complication. But
Oh.
one subtype which is very serious, even with best treatment, you still will have some complication. And some people are in the middle.
Okay.
So
Thank you very much, Doctor. Sorry to interrupt. We'll be back on Speak Your Mind. Gold FM, only the classic hit. This is Speak Your Mind on Gold FM, only the classic hits. I'm Louise Kaunisela. My guests are from the Diabetes Fijian Corporation, and we have Dr. Rajeshra with us, and also we have Viliame, who have been talking to us about diabetes. And this is a live radio talkback show. If you want to ask a question, you might as well call. The doctor is here and he can answer 3220-906, or if you have a Digicel phone, 7732906. Now, Dr. Rajeshwa, what about the treatment of diabetes?
treatment of diabetes is twofold. One is non-pharmacological, that's SNAPs, and it's also helpful in prevention of diabetes. And the other one is pharmacological. So I'll begin with the non-pharmacological, which is SNAPs. SNAPs represents for smoking cessation, S part, N for nutrition, and for all diabetics, it's essential they see a qualified dietitian. Dietitians are available by the Ministry of Health in all medical faculties. So if you are a diabetic, you must insist on seeing a dietitian. The other SNA is for alcohol. We want all our patients to be careful about drinking alcohol. In general, the best is not to drink alcohol, but a few glasses here and there is okay. P is for physical activity. All diabetics should be on an exercise program. We advise them what to exercise. Exercise is prescribed. Not everybody can walk, because if they don't have limbs, obviously they can't walk. They might have a heart condition, they might have a foot problem, they might have eye problem. So exercise program is tailor-made, and usually a physiotherapist or a doctor will prescribe exercise to the diabetic. But in general, the diabetic should be doing flexibility exercise, some aerobic exercise, and also strength training exercise, bodybuilding exercise.
So those three go together. So you strengthen the muscle. I believe when you have diabetes, your muscle tends to waste away. Is that right?
Yes, it does.
So that's why you say to do like strength training for your muscles.
Yes.
And for flexibility, that's stretching. Or
Stretching.
okay.
Yeah.
And then cardio, just to make your heart pump, I suppose.
Heart pump and become fitter.
Okay.
In general, become fitter.
So it's prescribed. Very important. You cannot just have a healthy diet and not exercise.
Okay. The other element, or the other two stresses, the stress, two S's, the stress management,
Oh, that's the worst one, I think.
and the most important one, insist on seeing a stress counselor. Or if you don't have a stress counselor, ask your doctor. You can go to the YouTube and look for stress management.
True.
It's very important you manage stress.
It's really something that stress can make you more sick.
Definitely.
I mean, it's like with diabetes. If you have stress, that means your diabetes is not going to get any better.
Yes.
And you need to control that stress.
Yes. And a lot of people misunderstand stress. They think stress is just worry. Now, stress is a physical thing. We are made up of electronic devices. We have nerves and hormones. So the nerves, if they are overactive, we are overloaded with electricity. And every part of our body has nervous supply and is under influence of electrical current. So if this is overloaded, every part of our body will be affected. and our diabetes and our behavior will be affected if we are overloaded with electricity.
Terrible.
So people who are stressed out don't even care about themselves. They stop looking after themselves. They stop taking their medication. They stop injecting, and they stop eating the right thing, even exercising. So stress management is very important in diabetic.
Yeah, so they can find something like maybe listen to a favorite piece of music
Yes.
that might help. If they start thinking that they're getting, stressed, listen to a piece of music or maybe do some, like you said, yoga, like what William has said. Okay, for diabetes, okay, we have high blood glucose, but I believe it can even go really low, and the both are really dangerous. Is that right, doctor?
Yes. Low blood glucose is usually a complication of treatment. So persons who have diabetes have taken their medications and have not eaten on time or have done a lot of exercise, their fuel levels can go lower. Like we have driven our car for too long and the fuel level goes down. So glucose is our fuel. Okay. So therefore, when we are on medication, we have to eat on time. And if we have exercised or done physical activity more than usual, we have to be careful and eat the supplementary diet. In addition, every diabetic should be careful and carry some sweets so that when they feel low blood glucose, they can take that sweet quickly.
Okay, so how will they know if their blood glucose is low?
Okay, we have this sympathetic activity. Remember the time you were having an exam? How did you feel? You felt nervous, you felt sweaty, your heart was speeding away. This is the symptoms we have. So they feel excessively weak. They feel as if it's the last day, they're going to die. So that means their blood glucose is low.
So you advise them to at least always carry
Something,
lolly.
some lolly or something sweet, maybe an apple, so they can eat quickly.
Oh, okay, so now when you say for diabetics to eat on time, what are the times that diabetics are, supposed to eat, and how are they to eat?
Okay, the diet advice is usually given by a dietitian. You have put me on spot, but it also depends on individual persons. Okay. Now, for a type 2 diabetic, my advice would be to go on intermittent fasting if they are not taking medication. That means they will intermittent fasting. This is something new.
Okay.
Is you fast for 16 to 18 hours per day, and then you eat maybe 1 or 2 meals, and you lower your carbohydrates. These are for people who are not on medication, newly diagnosed diabetics. In general, those diabetics who are overweight, we want them to reduce weight, and to reduce weight, they need to lower their carbohydrates and fat intake.
Oh, that's really useful information, doctor. Thank you. I'm sure a lot of people listening in would really find that very useful about the 16 to 17 hours intermittent fasting and lower carbohydrates and eat twice.
Okay. Those who are on medication, they have to eat on time, the 3 meals, and maybe in between the snacks.
So that's type 1 diabetes.
Any diabetic who is on medication,
Oh, yeah,
either type
okay.
1, type 2,
Right,
or
okay.
gestational diabetes who are pregnant, if they are on medication, they have to take the 3 square meals plus the snacks in between.
I see.
Okay.
Okay. All right.
So, Luis, they've been advised on what the diet they were supposed to take, yeah?
Yes.
And our focus is on, and these are different kinds of food we eat. There are some that produces raises glucose very fast, and there's some food that raises glucose at a bit a longer time.
I see.
For example, if you're taking pastries and cakes and all this, they raise the sugar level very high. And some of the food like rice and cassava, so they might take a bit longer time to raise to have your blood sugar to rise.
Yeah.
So it's very important that these are the foods that you have to take in less amounts, or the foods that raises your blood glucose very fast, and also those that you take that raises a bit a longer time, to take it in moderation. So like moderation, so 2 to 3 pieces or 2 to 3 pieces. And secondly, those that they don't raise your blood glucose level are some of the like vegetables. So you can take in
Any
great
amount.
Any
Any
amount.
Cucumbers,
Cucumbers,
lettuce, all that, lemon.
Yes.
But that's probably why you have dietitians at your various health centers to advise the patient on how to eat. And I'm sure you must tell them to maybe do a bit of backyard planting.
Oh yes, yes. We have to promote backyard gardening because you need so that patients can have access of healthy vegetables, fresh vegetables. Yes.
Yeah, I mean, even if you're gardening, you're doing your exercise as well. Eh? Okay, so that's what we're talking about. The dangerous parts of diabetes is when your sugar goes too high or when your sugar goes too low. So, what are the recommended? Well, actually, we have. I have to go into the break now on Gold FM. Speak Your Mind. Remember, this is a live radio talkback show. If you have a question, 3220906. But we will be back soon with more. Speak Your Mind on Gold FM, only the classic hits. Thank you a lot for your good company. I hope you're enjoying the program. Now, Doctor, I want to talk about the early presentation for foot care problems. Why is this really important? And I can't understand why a diabetic will not come to you for, advice if they do have something like a little problem that started on their foot.
So the problem with foot care is just like I have mentioned earlier, the blood vessels get damaged. Now, when the blood vessels get damaged from the glucose, the healing is poor. So whenever diabetics have a small problem, they don't heed to it. They don't come to the doctors early enough. It gets worse and worse, and the whole foot gets rotten away, and we have to chop off, leading to amputation.
Okay.
Now, unfortunately, with our population, I believe we have trust issues with our Western style medicine. Most of our people, they prefer going to herbal and alternate care first, and if it's not working, then they come to us. Now, I've seen again and again in my past 30 years of experience that all patients, they go to a herbalist first. I'm not against herbalist. They should try it out, but they could do both. They could go to the herbalist or the alternate care provider and also come to the Western care, which is us, the Ministry of Health, health centers and hospitals, as soon as possible. Now, we don't amputate every diabetic foot. There are, of one amputation done, there are about 10 who have healed.
Okay.
The public only knows about the amputation. They think that every patient who comes to hospital, they get their feet amputated. No, it's not the case.
Okay.
We have, in our clinic, every day, we have 4 or 5 people who get their foot healed.
Okay, so how is that they got their foot healed? Because they came in early.
They came in early.
Oh,
That
I
is the
see.
trick. You have to come in. This is not only for diabetic foot. It is any illness. If whether you have diarrhea, you have headache, you have vomiting. If you come to see the doctor early.
Yes. So, Luis, in our project, we were able to save more than 2,000 feet just through the program, and just because they were coming early and they were detecting early. Yeah.
So the treatment is what? Antibiotics, cleaning it up and all that?
Yes, we've got a whole program, antibiotics, cleaning it up. We have stress management. We control the diabetes better. Because if you have an infection, the diabetes will flare up and the glucose will go high and high. So we have to control it. We might have to use insulin. Patients are very stressed out because they're frightened. They might end up with amputation. The stress will delay the healing. So they need to go. We have them seen by a dietitian who will modify their diet. So we have this holistic approach of foot care.
Okay, so that's why it's really good that you have all these foot care places almost all over the country now.
Yes.
Okay, so carry on about the foot care problems.
More important than healing the foot care is prevention.
Yes.
We have this prevention program, and we have this rule that all diabetics should be taught the skill of examining their feet every day.
I see.
So these foot care nurses we have trained, they will examine and teach every patient, diabetic patient, how to examine and look after their feet every day. We have this slogan, you should look after your feet as you look after your face.
true.
Now remember, when we wake up, what do? We run to the mirror and see our face. So therefore, they should also look at their feet.
Yeah, because I mean, we tend to neglect our feet, don't we?
Yes, that's the last option. We hardly look at our feet.
Yeah.
However, with our faces, we over treat them. We do this
Yeah, the beauty.
cleaning and beautifying and all. Therefore, we should be looking after our feet
The same way.
the same way.
So, like when you tell them to look after their feet, what are they supposed to do? Like have a scrub it or clean it up or something like
Yes,
that?
you look at the feet. First of all, look
Okay.
at the feet.
Right.
If you find anything wrong, even a slightest scratch, you should see a doctor or a nurse as soon as possible.
Oh, thank you.
You should also wash and care for your feet,
Mm-hmm.
moisturize them. The nurses, of course, will teach
Moisturize, yes.
how should they be moisturizing, and also wear proper footwear.
Oh, that's the main thing, because sometimes you get blisters if you wear the wrong type of shoes, right?
Yes, and a
Okay.
protective footwear depending on the walk. So a cane farmer will protect their feet with a closed shoe. An office worker maybe have less closure.
Right. All right, then. Thank you very much, Dr. Rajeshwa, for your great advice, as well as our Foot Care Project Officer, William Gio. Now, Dr. Rajeshwa Sharma is at the Diabetes Hub Center, Suva, and I'm sure, I mean, if someone's listening right now, they're more than welcome to come, I mean, or go to the different centers around the country, or even see you in Suva. Is that right?
Yes.
Well, thank you very much on Speak Your Mind. That's it for today. Until next week, I hope you enjoyed the show. Nisamo Demanda.